Sakthi Dental Clinic Mullukurichi. Inlays and onlays are dental restorations used to repair damage to a tooth caused by decay or other dental issues. They are often used when the damage to the tooth is too extensive for a simple filling but not severe enough to require a crown. An inlay is a type of dental restoration that is custom-made to fit into the center of a tooth. It is typically used when the damage to the tooth is confined to the center or top surface of the tooth. An inlay is made in a dental lab and then bonded to the tooth using a strong dental adhesive. An onlay is similar to an inlay, but it is used when the damage to the tooth extends to one or more of the cusps, the raised points on the surface of a tooth. An onlay is also custom-made in a dental lab and then bonded to the tooth using a strong dental adhesive. Both inlays and onlays can be made from a variety of materials, including porcelain, composite resin, or gold. Porcelain is often the most popular choice because it can be matched to the color of the natural teeth and provides a durable, long-lasting restoration. Inlays and onlays are typically placed in 2 visits to the dentist. During the first visit, the damaged portion of the tooth is removed, and an impression is taken of the tooth to create a custom restoration. A temporary filling is placed in the tooth to protect it until the permanent restoration is ready. During the second visit, the temporary filling is removed, and the permanent restoration is bonded to the tooth using a strong dental adhesive. Thanks for watching. Like and subscribe.